Okay, let's go ahead and get started. I'm Janine Kokel. I'm a patient educator with the Mayo Clinic Cancer Education Program in Rochester, Minnesota. I will be moderating the session today. My colleague, Angie Murad, will be assisting today with technical support and assistance for managing some of the questions at the end of today's session. If you have any questions related to this topic today, please type them in the chat function at the bottom of your Zoom screen. You can do that anytime during the presentation, but we will take those questions at the end of the presentation. We want people to know that this session is being recorded, so individuals who are not able to join us for the live session can watch it at a later date. For those of you who would like to view this webinar again, the recordings take about 3 days to be edited, turned around, and then posted on our video library tab on our cancer education page on Mayo Clinic Connect. As a reminder, I know many of you know, but Mayo Clinic Connect is a digital platform where patients, family members, caregivers can connect, get evidence-based information, and can get access to information about classes and other programs that are offered. We encourage you to follow our cancer education blog on Mayo Clinic Connect so you can stay up to date on upcoming webinars and other educational opportunities. We will put the link to the Mayo Clinic Connect and Cancer Education blog in that chat function for you to find. This is the second presentation in a 3-week series on financial toxicity in cancer, managing the cost of cancer care. That term, financial toxicity, is used to describe treatment-related financial strain and all that goes with it that's experienced by people who are coping with cancer. We all know that financial impact is well beyond active treatment costs. This series of presentations will address the many factors that can really contribute to financial toxicity, identify strategies to manage debts, and tips for reducing financial burden, and really outline some financial resources that can be of help. Today's session is focused on managing the cost of cancer care for employment concerns. The session will review commonly used terms related to employment, review employment rights as it's related to medical care, discuss benefits and programs, as well as national resources that are available to support people with cancer and help them to navigate employment issues. It's my pleasure to introduce our speakers for this webinar series. Elizabeth Matthew is a licensed clinical social worker. She works very closely as part of a multidisciplinary oncology team at Mayo Clinic, Arizona's Cancer Center. She's been a social worker for over 30 years, 27 of those years at Mayo Clinic in Arizona, addressing the psychosocial and emotional support needs of patients and family, providing financial assistance, employment and insurance guidance, and finding available resources. Angela Young is a licensed social worker as well. She works closely also as part of this multidisciplinary oncology team at Mayo Clinic in Rochester, Minnesota. She has worked as a patient navigator for Mayo Clinic for 18 plus years. She has a wealth of experience and knowledge in working closely with patients, providing support, financial assistance, employment, and insurance guidance and resources. Elizabeth will take the lead role in presenting for today's session, and Angie will be the assistant. Another one of our subject matter experts is joining us today as a panelist, and she will assist with questions at the end of the program. Jody Chuk is a patient navigator at Mayo Clinic in Arizona. She's been a patient navigator for 7 years, 4 of those with Mayo Clinic. She assists patients locating beneficial resources that can help break down those barriers to treatment. And I just want to take a moment to state that these ladies have put together a very nice reference resource sheet with links on the resources that they will be referencing in today's session. So my colleague Angela Murad will be posting that link also in the chat function, so you can find that there. It will also be posted with the videos on our cancer education blog page, and also a cancer education blog video tabs page. So there's multiple places that you can find the videos and as well as the resource sheet. So with that, I want to thank you for joining us, and please join me in welcoming Elizabeth Matthew.
Thank you, Janine. Angie Young and I are honored to be the co-facilitators or co-presenters today on this very important topic of employment concerns. So let's get started. So the topics we will cover in today's
Elizabeth, I'm going to stop you for one moment. Joe, there we go. Thank you.
So the topics we will cover today in our session
Somehow you're on mute again. I'm sorry. Yeah, there we go. Sorry about that. Okay.
I apologize for the technical difficulties, so I will start over.
No worries at all.
The topics we will cover today in today's session are the Family Medical Leave Act, often referred to by the acronym FMLA, Americans with Disabilities Act, often referred to by the acronym ADA, disability benefits, Social Security benefits, Consolidated Omnibus Budget Reconciliation Act, often referred to as COBRA, and open enrollment. These are helpful benefits and information to be aware of if you or a family member are employed during cancer care. We will be providing a brief overview of each benefit, and we will also provide additional information and resources to support you if you want to further explore these benefits. Angie, do you have anything you would like to add?
Nope, I don't. Thank you.
So Family Medical Leave Act, or FMLA, is a federal law that provides employment rights to eligible individuals to take time off during an illness or to care for a family member without losing your job. So it's a Job Protection Act, and to ensure that employer health insurance benefits are maintained. This law guarantees eligible employees to take up to 12 weeks off in a 12-month period. FMLA can be taken as intermittent time off for doctor's appointments or days of treatment, or longer time increments, for example, taking time off after surgery or during your treatments. As this is an unpaid benefit, individuals generally use this benefit in addition to an employer paid benefits such as paid time off, sick time off, or a disability benefit. To qualify for FMLA, an employee must have worked for 12 months, including 1,250 hours during the most recent 12 months. FMLA requires that an application is completed by the employee, and also a portion of that application is to be completed by your physician. I think the most important takeaway of this benefit is that FMLA is a law to protect your job or a family member during a medical illness. For more information about this law, you can refer to the FMLA website that is on this slide. Angie, do you have anything to add?
I think the thing that I would want to stress about FMLA is that this is an employer benefit. So this is something that you would have potentially eligible for through your employer. So to get this process started, you usually need to start by reaching out to your HR department, your human resources contact, or your supervisor within your job to get that application and that process started. And then there is, as Elizabeth said, there is a medical component where the provider needs to sign off on the medical necessity for the leave. But this is a benefit that is an employer provided benefit. And you need to access through the employer to get started. And as Elizabeth said, it is federally It's a federal law. So, you know, they do need to, you do need to meet the eligibility criteria as well. And so make sure to read that fine print, but if in doubt, always ask, inquire whether or not it's an option. Don't assume you have it or you don't have it. I would always just say ask.
Thank you, Angie. So we're going to go over the Americans with Disability Act, again, often referred to as ADA. It is a national law intended to protect individuals from discrimination in the workplace and allows for reasonable accommodations to optimize one's ability to continue working while receiving medical care or during recovery after treatments or surgery. Examples of accommodations may include a modified work schedule, working remotely, reassigning you to a less physically tasking job, if possible, or modifying workspace. This law is to ensure that employers must provide equal opportunities for all employees. To qualify, though, you must be able to perform essential functions of your job, and also requires a physician statement of medical necessity. For more information, you can refer to the website that is on this slide, and I will ask Angie if she has anything in addition to add.
I think, again, what I would stress is this is a conversation that you would have with your employer based on what your needs are, based on what you're hearing from your providers in terms of what are your abilities to work. Many times patients in active treatment are able to work, but maybe need to have some reduced hours, or it might be easier if you have the ability to work from home for a couple of days after treatment, those days that maybe you don't feel the best, or for our patients that are severely immune compromised, perhaps not being in an office around a lot of people. And so exploring and having those conversations with your employers is especially important so that they can try and help meet the needs and make those accommodations. Again, this is a conversation. And I think while we acknowledge it can be uncomfortable and difficult to have, it is something that we stress is really, really important. And again, at the end, the resource list that we're going to provide, there are going to be some organizations out on that list that will further talk about the American Disabilities Act and how you have some of those conversations, how you start those conversations with your employers to kind of give you some places to start.
Thank you. So disability income is an income benefit that may be provided by your employer, private, state, or a federal program. Employer-provided disability benefits are often referred to as short-term disability and long-term disability. Short-term disability generally lasts about 3 to 6 months prior to transitioning to long-term disability, and long-term disability generally lasts 12 months or longer. And with long-term disability, often income is reduced. It's a reduced percentage of your salary. Both benefits require medical documentation and ongoing medical updates to support continued time off. So talk to your doctor if you want to explore just medically if it's appropriate to consider short-term or long-term disability during cancer care to ensure that they're able to support your disability request and complete the medical necessity forms. Please also note that not all employers provide short-term or long-term disability, and these benefits are determined by your employer. So to get more information, I think as Angie has shared, it is important to talk with your healthcare provider, with your physician, and explore your options with your employer. Some patients would prefer not to talk to HR right away, or some individuals going through cancer. But you may have a benefits package that was provided to you at the start of employment or as you renew benefits annually. And then there's also private benefits that patients or individuals generally will can get as an added benefit, either through their employer or through an insurance agent. And sometimes they're commonly called like AFLAC or another cancer insurance policy. Angie, do you have anything else you would like to add?
I think to further expand on those private disability benefits, those are typically programs that perhaps your employer offers as an option for you to purchase through a reduced rate through the company. But to access those, you usually need to submit your own claim. It's not something that your human resources department is going to assist you with. And so just understanding and remembering what you even have signed up for. I think the thing to think about is so many times these are either a combination of employer benefits or benefits that maybe you signed up through during open enrollment. And many times we forget what benefits we really have. So that's why Elizabeth and I stress connecting with the human resources department to figure out what exactly the benefits you have that are employer provided, and then which ones you elected to pay for on your own, and making sure you're accessing those. The other thing I want to stress is that Elizabeth and I keep mentioning that you should go back to your human resources department. When you go to your human resources department, the information you share with them is confidential. So when you reach out and you share that you have a diagnosis, that you are entering treatment, that you're, seeking medical care, they cannot share that with your colleagues. They cannot share that information. So it is information that should be kept private. So please understand that, that when you do reach out to them, it is expected that they keep that information private. And if you have any concerns with that, of course, then you would explore opportunities to report your concerns within the department or within your company. But it is the expectation that that is kept private. The only other thing that I think I would add about disability is that the percentage that sometimes you receive, the payment you receive is a percentage of your income, like Elizabeth said. And those oftentimes are benefits that are provided perhaps by your employer, but they outsource or they utilize a third party. And so it's not uncommon that when you do submit a short-term disability claim through your employer or a long-term disability claim, that you have a third-party vendor that will be reaching out to you. Ask who that third-party vendor is so that you accept those phone calls. You don't think those are solicitations, because you may, unfortunately, get put on some kind of a list somehow, or we all get solicitations where we're at, we get offers to help process disability claims, help process those. So we want you to make sure you're accepting the phone calls from those legitimate companies and the ones that maybe are just solicitations. So always ask your HR department, who is the third party vendor, so that you can be getting those calls when they come in.
Thank you, Angie. So we're going to talk about Social Security disability income, again, often referred to as SSDI. This is a federal disability income for individuals who have a work history. There's a specific amount of just work history to be eligible, who have contributed to Social Security and again, meet eligibility criteria and are unable to work for a minimum of a year or longer. Medical documentation and records are required during this application process, in addition to the individual calling and starting the application either by phone or online. And the application process can take up to 3 to 5 months. Social Security Administration has developed a compassionate allowance list that has a list of medical, cancer, and non-cancer diagnoses that often receive expedited approval for SSDI. It is important to know that even with the expedited approval, there is a 5-month wait period before receiving your first Social Security check if approved. Please refer to the SSA website or call the number on the website. Please also note that you can create an account if you go on the ssa.gov website for a personalized tool that can give you an estimate of your future disability or retirement benefits. You can do your application online. You can assess the status of your application and manage the benefits you receive or other helpful information and tools. Angie, do you have anything else to add on this?
I think just two things. If people would rather apply or do the application online, I think the thing I always remind my patients is the application is quite lengthy. But you do create, as Elizabeth said, you do create sort of a profile or an account. So it will save your application as you work on it. And so I think that's especially important for patients and caregivers to understand that you can come and go and work on it as time allows and as you feel up to it. The other thing I think is especially important for patients to understand is oftentimes you can apply for Social Security, or I should say all the time, you can apply for Social Security on your own. And typically you don't need the assistance of, a lawyer or any type of legal assistance to help this claim get processed. Within the oncology realm, it's usually very clear as to whether or not your cancer care will meet the criteria for Social Security disability. And so I feel like most of our patients, with the assistance of their medical team and social workers, usually can do the application either online or over the phone with just some minimal assistance along the way. And there's usually not any need for any type of legal assistance or helping you through a legal process to have your case presented in that manner for approval.
Thank you, Angie. Supplemental security income, again, often referred to as SSI, is a government disability or state disability income benefit for individuals who may not be eligible for SSDI, or maybe in that wait period, say you did not have Social Security or short-term disability through your employer and you have no income. If you do meet financial and medical state criteria, you could be eligible for this state benefit. An application is required, and if approved for this benefit, you may also be eligible for other benefits through the state, such as food stamps or Medicaid. And is there anything else you would like to add, Angie?
No, I think the thing just to keep in mind with this one is there are income guidelines. And so some patients meet the criteria and others do not.
Thank you. So the Consolidated Omnibus Budget Reconciliation Act, also referred to as COBRA, allows individuals to extend insurance coverage for certain qualifying events, which includes loss of a job, reduced work hours, when transitioning to long-term disability, and covers spouse and children in event of death. Generally, an employee transitions to COBRA insurance when transitioning from short-term disability to long-term disability. If you are transitioning to COBRA, please note that an employee has 60 days to elect COBRA once eligible, and COBRA provides a limited length of coverage. Generally, it is 18 months, but if you are approved for Social Security disability during that time, it's important that you know that you have the opportunity to notify COBRA. Really, we recommend immediately after you're approved for Social Security disability income to request that time or that length of time of COBRA coverage be extended from 18 months to 24 months as individuals are eligible for Medicare, generally 24 months, not generally, they are eligible for COBRA or for Medicare 24 months after receiving Social Security disability income. So monthly premiums for COBRA is generally high, but benefits allow you to continue your insurance coverage and the care that you're receiving. And it's important to keep the COBRA coverage if possible. Although the cost of COBRA premiums are high, individuals living with cancer recognize the cost of not having insurance or continuing COBRA is also high, as maybe you will not have insurance coverage or may have to change the facility or your oncologist if you're uninsured, or the insurance that you change to is out of network with your current providers. So that could delay treatment or become a barrier to care. If you're unable to afford the COBRA premiums, please explore other coverages that you may be eligible for to avoid a gap in insurance coverage. So we do encourage you to talk to your medical team if you have any concerns related to employment or insurance concerns at any point in your care. So you can be referred to a social worker or another member of your team. Angie, do you have anything to add?
I think what I would want to add to this is just to stress the importance that you have 60 days to elect COBRA coverage. So there's a short window of opportunity. And so I understand there's a lot of times where it's very, very stressful. A lot of paperwork is coming through when patients and families are faced with making these decisions, but it's especially important to watch out for this paperwork and make sure you elect that coverage so you don't have a gap in coverage, so that you don't lose your insurance and you remain insured. Elect that. And then if you have concerns about paying, as Elizabeth said, we can always meet later to discuss and look at other options that might be available. But we always want to make sure that patients remain insured.
Thank you. So open enrollment. So open enrollment occurs annually. It is a defined time period by your employer or federal programs to make changes to your benefits or insurance plan. Employer open enrollment benefits allow you to review your current benefits, ability to change or add benefits, such as maybe there's an added benefit of a disability coverage. A lot of employers are adding legal plans that you can enroll on, or maybe there's a higher level of insurance coverage that may be helpful as you're going through medical care. So those are all options to consider during open enrollment. And this open enrollment with employers often occur during fall. So it's important to ask your employer when your open enrollment is scheduled. Anything to add, Angie? I know that we also, Medicare also has open enrollment, and that happens during October and through December, where you can change your Medicare A B, C, or D plans, including supplemental coverage. And then marketplace enrollment also is available, and again, happens most often between November and December. And Medicaid is the state medical insurance coverage, which is you're able to apply at any time during the year. Angie, anything to add?
I think just to add that, most generally, as Elizabeth said, open enrollment typically happens in the fall. You elect plans that would then become effective January 1. Occasionally, there are some employers that have open enrollment in the middle of the year. And so, as she said, it's best to talk with your employer to find out when your open enrollment period is. But this is your opportunity to try and make changes. If you have different plans that have better coverage or different out-of-pocket expenses, this is your opportunity to make those changes, which is what a lot of patients choose to do that are faced with medical concerns and will be under care so that they have less out-of-pocket expenses. In the event that there's ever a loss of life, so death, a birth, change in residence, marriage, divorce, those are all special life-changing events, and you would be able to make changes to the insurance in the middle of the year outside of open enrollment, and you would do that by working with the Human Resources Department.
Thank you. So we have really reviewed a lot of information, and I oftentimes say complex information during this webinar. The goal is really education, information, and support can be helpful to make informed and thoughtful decisions regarding insurance and employment benefits, and may be helpful to improve your financial health and well-being during cancer care. So we again want to stress that the importance of talking to your healthcare provider, and that we do have a team available to address these concerns and really focus on specific concerns related to your situation, and are here to support you during this time. Angie?
Yes, and I guess the only thing I would add is that please reach out to anyone on the team with any concerns as soon as they come up, or even if you're anticipating. Some patients may be anticipating having issues with their employer regarding a certain leave, or they maybe have received some type of comments or have a feel that maybe their supervisor isn't going to be as flexible. Please let us know so that we can be helping early on to help manage and give you some points to have conversations with, so that hopefully we can mitigate or avoid any big concerns along the way.
I'm just going to jump in for a quick moment. This is Janine, and I know on there you listed the patient account services. So I just wanted to acknowledge that that's really at Mayo Clinic here, and maybe you already kind of said that, but where do people go in their own institution if they're not part of Mayo? Is that still just going to their care team particularly?
I think by going to the care team, it will really allow the care team to identify which supports in their team would be available to help with their particular concerns. So I would still encourage going to the care team.
Great, thank you.
And here are a list of just resources that are national resources and very helpful to provide additional information regarding insurance and employment issues. And again, we commonly refer patients or individuals to these resources, and we find them very helpful as well. And I think the resources will be added to the information that is available to you as a part of this webinar. And we will open it up for questions.
Great, thank you. I thought it was an excellent presentation again, and it's just really nice to have you experts talking about this and just sparking that conversation. And so while we're waiting for people to post their questions on the chat function, maybe I could start off by, I know you mentioned FMLA, and does that also work for people who maybe need a break for mental health reasons? Can they utilize that service?
They would have to talk with their physicians. And again, if the physicians are able to support that, it is definitely something, because of the level of emotional and medical symptoms, that is something that can be considered, but definitely it would be, as Angie said, a conversation to have with your team to better explore if that is an option, and also to make sure that the individual going through cancer knows that there is a team of staff available to provide emotional support during this time as well.
Yeah, great. We have a couple of questions here. FMLA paperwork. Does the care team primarily assist with filling that out, or can a patient navigator, social worker do this? What is the normal process?
So you do obtain the FMLA paperwork through your employer. There is a portion for the employee to complete, or if it is a family member, a parent, a spouse, or an adult child available or taking time off to support the individual going through cancer. Again, it is initiated by your employer, and there's a portion for the individual to complete, and there's a portion for the physician to complete as well. And usually on the forms, there is a fax number or information of where that information needs to be sent back to.
I would just add that if patients are having issues getting their FMLA paperwork filled out, I think the social workers and patient navigators can assist in facilitating that process. But as Elizabeth said, there is a section that does require the medical provider, the physician, to actually sign off on the medical necessity. It can't be solely completed by a social worker or patient navigator.
Okay, thank you. Another question. FMLA is good for, sorry, it just scrolled away from me. It's good for 12 weeks in a 12-month period. Is that all events, or per event? Are the 12 months considered in a calendar year or a 12-month period?
So it depends on the employer, how they want to handle their FMLA. It could be that it follows the calendar year. It could be what we call a rolling calendar year. That is a question you would need to ask your human resources department, to ask how your employer handles that. FMLA is 12 weeks in total for all events. So it's not 12 weeks per event. So for instance, let's say a patient has a cancer diagnosis. They also have a minor child under the age of 18 that has a medical condition that meets FMLA criteria. And maybe they're a caregiver of a spouse as well. All three of those total 12 weeks.
And that's a great question.
Great. Okay, next question. There's an apology, they missed it. They're sorry they missed it, but they wondered if you would talk a bit about how to apply for SSDI with the Compassionate Allowances Program. How do they make sure they can get this?
So the Compassionate Allowance Program, or it is a list of diagnoses that you can access. I think it is available on the Social Security SSA.gov website. And it goes through, like I said, cancer as well as non-cancer diagnoses. So you can access that, and the applications can be initiated through the SSA.gov website, or again by calling. The application is a pretty lengthy process, as Angie was stating earlier. So there is a way to save information and then continue that at a later time. So anything to add on that? And if your diagnosis is not on the compassionate allowance list, please don't hesitate to apply if you are unable to work and there's symptoms, or just from a medical standpoint, if you're unable to work for that minimum of 12 months or longer. But again, having the conversations with your physician, maybe a social worker or somebody, patient navigator on your team, can personalize just issues to consider as you think about considering for Social Security disability.
Yeah, and just to further clarify, the compassion allowance is not a separate application. That really merely is just a list of diagnoses that they process the Social Security applications differently. So they're, I guess, for lack of better words, perhaps maybe fast-tracked would be maybe an appropriate use to kind of, it's more what they use internally to process and prioritize applications. So if you have a diagnosis on that short list of on that compassionate allowance short list, your application is considered fast-tracked, although I will say we use that very loosely, because I think Elizabeth and I would both say it's not super fast. We're not talking overnight or a couple of days. We're still talking a length of time, but they are prioritized if your diagnosis falls on that compassionate allowance list.
There are many steps. So once you do the applications, they will need your medical records. There's, the time it takes for that, but definitely the compassionate allowance list, the diagnoses on that list do oftentimes get approved. And so that is, I think, a part of offering that list as well.
Great, thank you so much. Do you find that people are getting full and accurate information from their employers? How do they know if they're getting the right information, the right answers that they need for completing paperwork and such?
Elizabeth, did you want to go first, or?
I can.
Okay.
And again, I think it really, my experience in working with individuals is really my best gauge. So I do know that some employers probably provide better information or have a better support, either through HR or through your manager, or to be able to access your benefits online. A lot of employers are offering information online or on a portal that you can access as well. But I also have had individuals that I've worked with that have not gotten good information. So oftentimes it is helpful to maybe talk some of that through, or visit one of these websites to get information and be informed prior to reaching out or knowing what questions to ask. So I think that those are often conversations that I have with individuals that I work with, just to help make them more educated, but also issues to consider for them to make an informed choice in their situation. All right.
Angie, did you?
Yeah, I was just going to say, I agree. I can only gauge it on my experience with my patients, and I would say it's a mix. Some have really good support and others do not. I think the one thing that patients and family members can always leverage is what benefits did you sign up for during open enrollment? You can always go back to what benefits did you enroll in. So you should always know what you have available to you. And then I always say it never hurts to hang on to what's that open enrollment book that's given to you that's quite massive. And quite honestly, most of us probably don't read in entirety, but that will give you a lot of information. And then if patients are second guessing or aren't sure, again, that's where we really want you reaching out to the team so that you can get connected with either the navigators or the social workers. So we can kind of listen in and just say, what have you tried? Where do you think there are some barriers, or where aren't we getting answers? So we can try and help and, give you some clarification and maybe questions to ask to move the process along.
Great, thank you. You're just speaking about open enrollment, and question is, do you need additional, what do you do if you need additional insurance because of you now have a cancer diagnosis and yet your open enrollment is already passed?
So if your open enrollment has already passed and you didn't elect insurance, you're really going to unfortunately probably have to wait until open enrollment comes around again. That's why it's so important. Then we stress the importance of making sure you elect benefits. So hopefully at the very least you elected medical benefits and you're not completely uninsured. Sometimes those added benefits, like Elizabeth talked about, the short-term disability, the long-term disability, the private cancer policies like AFLAC or some of those, you may or may not be eligible to apply for those the next time you come around. Interestingly enough, those are the policies, life insurance policies, AFLAC policies, those are the policies that can do a check on your past medical and they can exclude you. So you may or may not be able to ever get one of those policies during open enrollment, depending on if you had elected or not elected.
Okay, great. Another question, in regards to FMLA, what would be the process of becoming a caregiver and where could you find more information to obtain just facts and information about this, and what needs to be considered to be qualified as a caregiver?
I wish, Elizabeth, you can add in, but I would just say that the resources we listed have the criteria pretty well laid out for FMLA and who can be defined as a caregiver or who would be considered a dependent or a close family member that would qualify for you to apply for FMLA as a caregiver. Your employer should also be able to provide you that list. And then in terms of all the resources Elizabeth and I listed on there under the national resources, they all have information on FMLA. And it's all very patient friendly, very easy to read and comprehend and access. If you access those resources and still have additional questions, again, I think go back to your care team.
And just to clarify, the caregiver and the support person, again, it's a spouse, a parent, or an adult child. They would reach out to their employer, but the medical portion of that application would be completed by the individual going through cancer. Their physician would complete the medical portion of that application. So just wanted to add that.
And just also as a reminder that we did post the link for that resource sheet earlier in the chat function. So if you can go to the chat function, scroll up, you'll see that. So let's see. Oh, and Angie Murad just posted it again. So, okay, I think that's it for our questions. And so I just want to thank you for your time and sharing your expertise and for this excellent program. Thank you. Thank you for joining us, everybody.
Thank you.